So mine is on.
Test. Test, test. 1, 2. All right. The mics are on. I almost hate to break up this wonderful conversation. It's so lively, so early in the morning. Well, there we go. Wonderful. Well, good morning, everyone. Bonjour à tous et à toutes. Kwe. I would like to begin our Future of Health and Wellness series event by acknowledging that we're gathered on the traditional unceded, unsurrendered territory of the Anishinaabe Algonquin people. As guests, we are honored to gather here today, and we thank all the generations of Anishinaabe Algonquin people who have and continue to take care of this beautiful land. Trees to give us shade, water and food to sustain us, and pathways to connect us. Algonquin College recognizes and appreciates their historic connection to this place, and we also value the contributions of other First Nations, Inuit and Métis, who have shaped and strengthened this community, this province, and this country. So good morning, my name is Claude Brûlé. I am the President and CEO of Algonquin College, and it's my distinct pleasure to host another series in our Future of Health and Wellness series of events. Now, we've been hosting this series since 2016, as I said to some of you earlier, and we've covered the gamut from health and wellness, from neonatal care to palliative to policy development at all levels of government. And we've had ministers, we've had international guests, and we're delighted today to be, and I'll introduce our guests in a moment, to be covering the topic of emergency preparedness and the elements of public health related to that. So we're offering this event in a hybrid mode. So for those of you who are not familiar with this, it means that imagine we have the same size audience, but they're somewhere in the ether. So we're welcoming our online audience here this morning, as well as our in-person at our corporate center here, which we affectionately call 700 Sussex by its address, but it is our corporate training center. So welcome to everyone. Those of you who joined us a bit early, hopefully you've had a chance to have a bit of a tour. And if not, if you're free afterward, we can give you a quick tour of our facility. I would also like to take the opportunity to present to you our hashtags for today. I encourage all of us to use them to keep the conversation going. So share them on social media and use the hashtag ACHLE or hashtag ONHealth, and those are on your screen right now. Thank you. So this event continues to be the place to share ideas, spark conversations, and discuss matters of relevance to the future of health and wellness across our community. Before I go further, I'd like to acknowledge the presence of some community stakeholders who have joined us this morning. So joining us remotely, we have Catherine Kitts. She's a City of Ottawa Councillor for Orleans South Navan, Ward 19, and she's the chair of Ottawa Public Health. And we have Tanya Buckley, who's a Algonquin College Board of Governor members. And in person this morning, we have Councillor Ralston King with us this morning. Good morning, Councillor King. He's the councillor for Rideau Rockcliffe, Ward 13, and I had the pleasure to be with Councillor King last night at the Volunteer Ottawa Award evening. So great to see you such a short space of time. Thank you very much for being with us this morning. We also have a number of Board of Governor members who are here this morning as well. Jamie McCracken, our board chair, Stephen Tudor, our board vice chair, and his wife, Marianne, thank you for being here. We have Gabriel Berrar, and we have Wada Almonefi. Thank you for joining us this morning. So thank you for joining us, and I want to thank a big thank you to Ottawa Public Health. I mentioned them a couple times here. I don't think Dr. Vera Etches is here with us this morning. However, she's a great supporter of this series. We have several staff members for OPH here with us. They're a great partner in this series, and they help us put together the event. So thank you for being here with us this morning. And so we're honored to have a panel this morning that will be joining us both in person and remotely. And I'll start with Dr. Yasmin Khan. She's online this morning, and she's the Associate Professor in the Division of Emergency Medicine, Department of Medicine at the University of Toronto, and the Clinical Public Health Division at the Dalla Lana School of Public Health, and a physician lead in health protection at Public Health Ontario. Good morning, Dr. Khan. Welcome.
Thank you.
We have with us Sergeant Sam Roberts. Sergeant Roberts is a former emergency management coordinator for the Ottawa Police Service. He's certified in Ontario as an incident management instructor and certified through ICS Canada as an incident command system instructor. Welcome. Thank you for joining us. And we have Nicole Robert, formerly the Executive Director for the Geriatric Psychiatric Community Services of Ottawa. She's a registered nurse. Thank you for joining us this morning. And as I said, this morning we'll tackle the topic of building community resilience through emergency management and preparedness. Like other communities throughout the country and the world, our city and region has experienced a number of significant emergency events in the last few years that we've all been marked by, and many of them have had public health impacts. These emergencies include severe weather events and other public related emergencies have required our community to mobilize in response to, and have also highlighted readiness gaps, which we'll cover this morning, particularly where people are living and facing greater disadvantages or barriers. So that's the topic this morning. Let's get started. So perhaps I'll start with you, Dr. Khan, this morning with my first question. As part of your research, you've identified and you've studied how public health agencies and emergency departments communicate during emerging incidents. Can you share with us what you've learned from this research and what are some best practices that would enhance how these sectors can collaborate to respond in emergency responses?
Thank you. Thanks for this question. This actual project was very near and dear to my heart because as you noted in my introduction, I come from both an emergency medicine as well as a public health background, and certainly local public health and healthcare are really important partners that collaborate to support emergency management. While it was a topic of interest to mine, the reason our team wanted to study this question is because there was really limited evidence at the time informing communication between clinical settings and public health. And in the context of emerging public health incidents, communication from public health is often really urgent, needs to get from public health to the frontline clinician within hours. In terms of the relationship with the community, emergency departments really represent, in some respects, the front line of the health system and a key interface with the community. And so that's another reason why this was an important question to ask. And also clinicians themselves working in emergency departments are high risk for exposure for those emerging health threats. So in terms of what we found that can support best practices for collaboration across these health sector partners. We found in studying this topic in Ontario that both urban and rural regions in the province, that the communication between public health and emergency department clinicians in this kind of a context is really based both in these urban areas as well as rural in the development of close relationships and networks. And so opportunities for intersectoral initiatives and collaboration, particularly during planning or preparedness, can contribute to more effective communication. So examples such as planning tables, initiatives, and practices such as simulations or exercises. Another finding from the study was that sensitivity to uncertainty and acknowledgement of uncertainty of an emerging situation. And the message is really important in conveying from public health to clinicians, as is the context in the given care setting, and recognizing for this study, which took place in Ontario, there are really quite a variety of clinical settings that would fall under an emergency department, and the importance of being able to tailor the message for a given context. And finally, in terms of getting knowledge transferred or understood in a really timely fashion during an emerging health incident, it's really important to acknowledge as an active, really a two-way process that's enhanced by those opportunities for feedback and clarification.
Thank you very much, Dr. Khan. It's all about the planning phase and being able to have really strong communication between all the parties. So thank you for that answer. I'll turn to Sam Roberts for our next question. Sam, throughout your career at Ottawa Police Service, you had extensive experience in a wide range of emergency management areas, including natural weather events like floods and tornadoes, terrorist attacks and mass protest events like the February 2022 downtown occupation. So how can local emergency services improve their collaboration with, let's say, private sector partners and local community group leading up to an emergency?
That's a mouthful. First responders work really well together because we do. That's the name of our job. We work with the community because that's who we serve. What we don't do is we don't really talk to the community. A number of years ago, the City of Ottawa used to have a program, was the P3, Public and Private Partners, and the police service was an active partner in that, within that group. In fact, that was the first time I ever actually stood on stage and gave a presentation. But that was an opportunity for us to actually meet the community and meet the organizations and understand what they're looking for and understand what they can assist us with. So as a first responder, when bad things happen, we go out and we do our job. But when it's done and we step back, there's still the aftermath that has to be dealt with. But we need to ensure that we're working closely with the partners to make sure that the community is properly served. So we look at the flood. Well, we'll come in and we'll do our thing and we'll help evacuate. But then when the flood is over, we go back to regular policing because we don't know sort of that community connection. But if we bring together, more programs like that P3 program, then we have an opportunity to actually speak to those who have issues, those who will need more. In fact, I often have this conversation with a friend of mine, actually a colleague from, a former colleague, I guess, with public health, Christine Taylor, and we challenge that, and it's everybody from the vulnerable sector right down to those living out in the rural area. Just a quick show of hands here. Do you know your neighbors? Yeah, you do? Do you have your neighbors over for drinks, wings, right? Yeah, the hands get less. I lived in Barrhaven for pretty well since 1999, right up until 2022. That's a mouthful. But I now live out in the country. So I live on 30 acres out in Lanark. I know my neighbors more who are 200 acres away in the country than I knew my neighbors that were right next door to me. We'd shovel snow, wave, hi, how you doing? But my neighbors out in the country, hey, I saw you, the lights were on, I drove down your road just to make sure, blah, blah, blah. You know, I knew you were away. Right? We don't do that. And in the first responder community, we don't do that because we're always running call to call to call. So we need to actually reach out to the community and let them know exactly what we can do and what we can't do. There are a lot of assumptions that the police will just come in and we'll just do whatever. The paramedics will do whatever. That's not always the case. But if we have the opportunity to sort of engage in that P3 partnership, then we can identify things that you need. We can connect you with other aspects that may assist you. If you bring your neighbors in and we're all having the same conversation, we'll connect your neighbors so that you build your individual resiliency, so that okay, I need to have water and food and medication and make sure my dog has water, food, medication, all of that. But then you'll also check on your neighbors. If that doesn't happen, then the reliance is always on the first responders, and the first responders' job is to go out and deal with the things that are happening right now. When I was a rookie cop back in 1998, I'm dating myself now, with the massive ice storm, brand new, fresh on the job, and one of the things I did was my friends, and I was policing in Cornwall at the time, I actually drove hairlessly through terrible streets and freezing rain to knock on the door and see if my neighbors and friends were okay. That doesn't generally happen as much, and I think that we need to build that. And the police, paramedics, fire, whatever, first responders, we have an opportunity to really build and support that sort of item for individual resiliency, community resiliency, and honestly, it'll take the heat off of us so we can do all the stuff that needs to be done and then come back and help you.
That's a great point, Sam, and the need for building that basic resiliency at the individual and local neighborhood level, I think, is critical. So, Nicole, I'll turn to you because some of the events that we've faced in the last while have shone a light on a particular vulnerable group, and that is isolated older adults. And in some cases, what we found is that they're some of the most vulnerable residents during an emergency. I'm wondering if you can speak to us about the unique needs and the most significant risks that older adults encounter during emergencies.
Mm-hmm. So I've dissected that question in needs and the risks. When you're looking at older adults that are isolated, it's always been a challenge for any kind of service to identify them. So the most important need for an older adult is to have support. Have support from the family, extended family, or informal services. If they do have access to informal services, that's very important need. They also have, as the police gentleman beside me told, they need to know who their neighbors are. The neighbors are excellent support for the older adult. They can know if they're not answering their phone, or if they haven't seen them for a few days, whether they're in a condominium, an apartment, or out there in the community. Is very important for neighbor support. The older adult also needs to know what the emergency is all about. How are they going to know about what the emergency is? It's important that there is media bulletins that are regular, but that are done in very simple, clear languages. That's the most important part. If they know regularly what is happening, then they can just relax and say, I think I'm fine. I don't need to advertise it anymore. They also, I think the important part of a need for the older adult is to have a contingency plan. Now, a contingency plan is how are we going to prepare if there is an emergency? I'm more in the medical field, so I've looked at the tornadoes, the floods last night. But the important part is not only having a contingency plan, but practicing it. It's good to have a contingency plan, but when the emergency arrives, they're in a panic, they won't know what to do. To practice it regularly, either with family or with informal services. They also need to have the numbers of their contacts clearly visible and easily accessible. Therefore, there should be a big sign on their refrigerator or whatever is more accessible for them to have those numbers in case that they need to use them immediately. The other access is also to have powers of attorney. Now, I'm a capacity assessor for the Ministry of the Attorney General, and most people don't have powers of attorney for personal care and finances. They need to have these papers in place so that people know if they find this isolated person, who do we call? There are papers available, and your powers of attorney should be knowledgeable that they are the powers of attorney, because they're supposed to be asked to be powers and agree to that. So that's very important. As far as the risk, naturally, is the isolation. How do we identify them? And there's also barriers with culture and language. Now, we're in a multicultural area, multi-language area, and most people have cultural issues with risks and emergencies and letting people aware of their situation and how to manage it. They also have a lack of formal and informal support. That's also a very important risk. They also have often a lack of knowledge of what's going on and the danger of an emergency. They have to be educated on that by either the family or informal support, formal supports. They also have the lack of essentials in emergency. Lack of, I'm sorry, lack of essentials in emergency. So if you have family and informal support, they should look at food, electricity, heating, and also financials. Are they going to be able to manage through an emergency that lasts 3 weeks, like the convoy? Do they have the funds to be able to support themselves for that long and to get to the bank or to have someone go to the bank? They also have, a lot of the older adults have cognitive deficits, mental health issues, so people have to be aware of those issues. Cognitive deficits make it difficult for a person to act normally or to act in reality when there is an emergency. And mental health issues are the same. We have a lot of elderly people with Lewy body dementia, with psychosis, and that's important to identify if they have formal, informal services. The housing situation is also a big risk for the elderly. We're looking at relocation, homelessness right now. A lot of the homeless people are people that are older adults. They're not isolated, they're in the street, but they are isolated in their way of living. Therefore, housing has to be looked at to make sure that the older adult has a sufficient location to be able to manage either in a condo, an apartment, or even in a retirement home, in long-term care facility, and again, a financial person to be able to manage their situation should they not be able to do so.
Thank you very much, Nicole. A lot of pieces to think about when we're talking about vulnerable population, in particular, a senior population. When you can imagine, having to displace a group of people and relocate them because of an emergency situation, and you're dealing with all the issues that Nicole raised. It's a lot to think about, and it's important to have this in the back of your mind as a planner, and as an emergency responder, and as someone who is supporting those groups of people. So thank you for that. Do you want to add to that, Sam?
Yeah, I did. Actually, one of the things you said I thought was fantastic is you spoke about communication and the ability to get communication out to, especially the vulnerable sector, the elderly. We discovered during the, during the tornado, actually, and it happened again during the floods, that we changed our messaging as things were unfolding. No problem. We sent out text messages, we posted it on websites, and then later on we realized that the west half of the city is in darkness. And then we realized that a lot of the elderly folks didn't have computers, so they knew nothing. So they were in the dark, literally. And as a result, we were getting 911 calls from family members outside of the city of Ottawa to go and check on their loved ones. But if that community resiliency, that the neighbors go next door, knock on the door, and have a quick chat. This is what's happening. This is what's unfolding. This is how things are going. This is what's latest, in the news. Then that really takes the pressure off of the first responder to be able to go and deal with the actions that are happening. As a result of that incident, we ended up having to create more teams, pulling first responders away from doing first responder stuff to knock on doors to check on the vulnerable sector. So it's vital, but communication is very, very key.
And to add to that, I was speaking with gentlemen yesterday and at a luncheon, and they were saying that in some of the communities, there is a person responsible, and it changes every week, to go from house to house in their little locale to make sure that the persons are fine and they have no needs right now. So I think more and more of that, it's neighborly help, it's an emergency preparedness before an accident happens or an emergency happens. And I think it can be easily done, and that's a neighbor that initiated that. So the neighbors have done this regularly, weekly, monthly, I don't know how long, but that's what they're doing. So it's another way of looking at isolated people and identifying if they really need help and there's a real emergency. It's being proactive rather than reactive.
Indeed. And you've mentioned a couple of things we may come back to in a moment around urban versus rural perspective, and also culture and language. I think those are interesting dimension to think about when we're talking about emergency preparedness and public health impact. I want to come back to you, Dr. Khan. You know, the pandemic is still very fresh in all our minds, and especially those involved in the healthcare. How do you think the pandemic has impacted the role of the health sector, including public health, in emergency preparedness? In your mind, what are some of the key lessons that through the pandemic that the health sector now needs to integrate into emergency preparedness?
Thank you. I'm just going to do a sound check because I had to change my mic. Can you still hear me okay?
Yes, we can.
Okay, great. So thank you for that. I mean, I think in terms of impacting the pandemic, impacting the role of the health sector in preparedness, my sense is that if we think about preparing for all types of hazards for the future, whether infectious or non-infectious, the pandemic may have helped to reduce some of those silos between sectors, so outside the health sector, and demonstrate how, whether across health, education, social services, public safety, how that whole of government or whole of society approach really is needed for the complexity of emergencies that we're facing. And so this is this, I hope, was seen during the pandemic and is a positive that I hope will have ongoing impact. In terms of lessons and what has been learned, that's really important. I mean, shaping this a bit in relation to the research that our team has done, and even pre-pandemic, we asked in our research what makes the public health system resilient. And what we found in relation to that answer really, I think, still resonates with the lessons that I'm hearing being discussed across the sector at this time. So just to give it a few. Just to give a sense of what was discussed in relation to public health system resilience. And then I'm interested to speak a little bit more about learning itself. But governance and leadership was described as important to resilience. And this we saw during the pandemic as an important lesson, the importance of having clear roles and a clear leader who can communicate to the public and to the relevant sectors. The relationships, so the collaborative networks, was another component described in terms of resilience. The community, we've been talking about the community, that's the focus in relation to our discussion on preparedness today. So the importance of understanding and engaging with the community. We learned over the course of the pandemic from in the health sector about how to do that differently, how to do that more, and how that might benefit from being tailored. Our workforce, so our people, that's another important learning, how reliant we are on our knowledgeable, skilled, and resilient staff. And in terms of learning itself, learning was identified actually as another strategy to build resilience in our system. And so one of the lessons that I find really important to reflect on is that we're trying to learn these lessons. We've identified lessons, but at the same time in the health sector, we actually haven't really stopped responding. We've had other novel outbreaks like Mpox. There's been wildfires in our communities, other emerging health issues that we've been responding to over the recent months and years since 2020. And so part of building learning does support resilience in the system. And so I think one of the key lessons is really to include the idea of adapting, learning, and improving as a continuous process within our collective system, within the health sector, and with our partners, so that we're building that into our plans and ensuring we're getting that feedback. So we're continuously learning, because the health risks aren't really stopping. There's more ongoing in our current context.
Thank you, Dr. Khan. And in terms of that preparedness that you've mentioned a couple of times, you know, the communication, so leadership, governance, and communication is critical. One of the underpinning of this are the people, right? And as people change role, as people change organizations, there's a constant need to reestablish relationship, understand who to contact in another organization, and always refresh that information so you can maintain that network, because it's going to continuously evolve, and you don't want to be caught short when an emergency occurs. So Sam, I guess, can you share some perspective about the development then of partnerships across levels of government and other public and private agencies, as well as perhaps educational institutions where we are large aggregators of people, and in terms of emergency planning initiatives, how do we sew this together?
We need to do exactly this and bring everybody together in exactly functions just like this, and have a discussion and understand what that other group can bring to the party, essentially. How can we help them? How can they help us? Quite often, especially in the last little while, I've seen that, especially within the government, it's very siloed. Provincial government does one thing, the federal government does another, local government does another, and you know, even if we're talking counties, and there's quite honestly, it almost is a little bit of animosity. We're going to do our thing, but we're not going to talk to them. They'll come in and take over. They won't help us, or whatever the case may be. We need to, you know, knock down those walls and have the discussion and bring everybody together and understand this is our problem. These are our hazards. These are the things that we see all the time. It just seems like poor Ottawa is getting beat up all the time, right? Heat, cold, tornadoes, floods. We're not new to dealing with that. But when we get to that point that we've got to ask the provincial partners to come in, there's a lot of red tape. If we look at the convoy, and then we're talking to the federal partners for some assistance, there's a lot of red tape. If we bring everybody into the room, sitting at the same table, put our cards on the table and have that discussion, and understand that if this happens and we've reached our limit, how do we get to support from you sooner rather than later, as opposed to 17 phone calls, 40 emails, and 3 weeks later, right? We don't have time for that. We need to, you know, I'm sort of a tell you like it is and do it right now guy, and this is what I want, this is what I need. And likewise, if you need something, I expect that you're going to come back to me. Now, going back to what I was saying about that 3P partnership, way back then, we actually invited some of the federal partners. So we had the Justice Department, and they would come down, and we talked all about lockdowns. And all of our school kids know how to do it, but the average adults, right, you know, our vintage, they don't know how to do it. They don't know what to do. But in that room, there was a discussion, there was communication, and all of those organizations went back and formulated a plan. But the plan they formulated was based on what they're going to do with an understanding of what police are going to do when they arrive, what paramedics are going to do when they arrive, what the fire department's going to do when they arrive. So we're not hindering their actions, and they're not hindering our response. So in terms of planning, the biggest and best thing that we can do, everybody come to the table, let's have a coffee and have a chat.
Thank you, Sam. And you know, to put it vividly to everyone, we have a situation right now with our neighbors south of the border in Maine, where you know, entire communities are being asked to shelter in place. And you know, a couple of hours, sure, you can deal with that. When it goes on for half a day, multiple days, and suddenly you start thinking, okay, do people have what they need to shelter in place, especially vulnerable populations, and that takes a whole new dimension. What you thought as the original emergency issue now takes several other dimensions that perhaps weren't foreseen at the beginning. So part of that resiliency you can build as far as you can, locally and to the individual is so important. Nicole, I guess coming back to, again, senior or older adults in emergencies and the example that I just gave as an example here, what do you see as the main gaps for supporting older adults in emergencies? And I know you've spoken to some of that in your previous answer. What are our ideas and opportunities to collaborate to address risks that are perhaps posed to an older population during an emergency?
One of the main gaps is to identify who these older adults in isolation are. So I think if we have service providers that are visiting these community agencies that are visiting older adults and adults with dementias and the other adults that we see in the community, they should be able to identify those that would be at risk in the case of an emergency. If they do identify that person, they should look at the emergency preparedness of that person. How does she get her food? How does she manage paying her hydro bill because it might go out? Does she have a phone, etc.? Does she have a plan? The real gap, though, is communication, sharing of information between agencies. It is such a gap because of the privacy issue. You'd like to get as a service provider, and I've run into that when I was the executive director, my case managers wanted information. Oh, we can't give it to you because you don't have the right consent. Well, often the person has dementia, so she can't give you consent. There's no family. Sharing of information is a key gap with the seniors and the older adults in our community and in all the communities. Also, the importance of maybe having more police staffing for the wellness check. An important service that the police does is wellness check on our older adults. It is excellent, and they can identify issues, and if there needs to be hospitalization or increased support, they can share that information with the formal and informal supports. The other one was an engagement of city councilors in certain areas, such as there was an example yesterday in Navan when there was this freezing and all that. The councilors were the one that paid up the plan and helped the community look up at that emergency, and they were quite helpful. They have the resources of their city. They're part of the Ottawa city, but they're more rural. So therefore, there had to be other people that helped them out with their emergency preparedness. As far as ideas, I've already mentioned some. Again, the contingency plan that each person should practice, but that contingency plan has to be involve people that will respond. You can have a plan and have people in that plan, but they're never available, then the plan doesn't work. It would be important to have an information kit, whether it is a flooding or an ice storm, whatever, that information kit could provide ideas of how to prepare ourselves for those in a general sense. Also, it could be an info pamphlet, info booklet with step-to-step directions in that pamphlet. Clear and simple, non-frightening bulletins, not through the computer. Most older adults can't use a computer, and sometimes myself. But at least if it's clear, it's either on the television, on the radio, and non-frightening, so that just to relay what should be done and what is happening. Also, involving the police and the paramedics and the community in a plan for a general emergency, not just a specific, as I said before, to be proactive rather than reactive. And also, that's pretty, again, looking at language and culture so that we can identify what suits better a certain culture and language issues, and try to allay the language barriers in these preparedness situations.
Thank you very much, Nicole. So preparing for the difficult task of having a scenario, let's say, and then making sure people participate, it's so important, and take it seriously as well. We've had situations where you put an exercise together, you go through the entire process, whether it's a tabletop or whether you actually have simulation, and then people say, oh, it's fake, or it's just simulation, and they don't take it seriously. So you really need people to engage, because if that particular scenario is to unfold for real, you want as much instinctiveness to take place as well. And right.
So at Algonquin College, I'm one of the facilitators there for the emergency management program, and one of the courses that I actually teach is the exercise design. And one of the core pieces that I push through to my students is you need to get buy-in and engagement from all of those involved. And it really has to start at the highest level. The highest level can't look at your exercise and go, oh, it's a tick in the box that we have to do for today. They need to get involved, and they need to really push the issue, because if that doesn't happen exactly like you've stated, it's going to be, oh, it's Thursday, we're doing a tabletop, whatever. But at least the coffee's good, so they'll show up and not really pay attention. But you need to really ensure that they understand. And one of the things that you need to do, and I'm speaking at sort of an organizational level, is ensure that those involved in the exercise know that you're not being tested. You as an individual are not being tested. It's the policies, the procedures, all of those, your plans, that's what's being tested, not you as an individual. And we can take that and roll it right back down to the individual level. The neighbor walks over to, the elderly neighbor and says, hey, let's have a coffee or a cup of tea and we'll talk. Have you checked all of those numbers on the fridge? Do they still work? Are all of those people there, right? And have that discussion. Update those records. If you do it once a week or once a month, you've done something. And that can be considered an exercise over a cup of coffee or a cup of tea.
That's a great tip. I'm logging that one away. I'd like to open it up to the floor. I know we can't have the online audience ask questions, but I know the conversations that we have had so far this morning, I see some people are going, okay, some food for thought here. So I don't know if we have a couple of mics here. Just put up your hand and we'll bring the mic over to you. Okay, we have one question over here and a couple over here.
Hello there. Hi, can you hear me?
Sound is coming up. Yeah.
All right. Okay, I'll talk a bit louder. And yeah, I had one question regarding community. In fact, I've got two, if I may. But one question regarding the sense of community. Do you think since the pandemic that might have developed amongst us, realizing how important it is to look out for each other? To the panel.
Okay. Maybe we'll start with Dr. Khan. Were you able to hear the question?
The other question was.
Sorry. We'll wait and see.
Okay.
I think what I heard was if I think that the sense of community may have enhanced over the course of the pandemic.
Whether it has or not, and what you're seeing in that regard.
Would you like me to start?
Sure.
Okay. I think it depends. I think there's been things that have gone really well and relationships that have really been enhanced. And as I mentioned, that whole of society approach, like in some aspects, worked well for some initiatives, including vaccination as it relates to public health. We have seen also some erosion in trust in relation to public officials, and so I think how I would answer that in relation to the future is, I think we need to continue to, or we need to be explicit about an ethical framework from my perspective in supporting emergency preparedness when we're working with the community, so that we're being transparent, we're building trust, we're acknowledging equity. And I think if we move forward with an ethical framework as part of preparedness, I think that can support building trust going forward.
Thank you, Dr. Khan. Any other reactions from the panel?
I would say that I'm not in the field with the agency anymore, but I do assessments. And I would feel that the service providers now are probably more acutely aware of the care that of their elderly, and they're probably more astute in identifying which ones would be more frail if there was another pandemic. And that would be my feeling if I was a case manager in the field, definitely more aware. And I feel that the people around, families and so forth, are more aware of being protective of the people that they meet, or are not being involved in larger groups just to protect the elderly that they have in their family. So I think that makes us more aware of the transmission, the easy transmission, especially when we're looking at a medical issue.
So from a policing standpoint, we sort of saw the opposite. A lot of folks basically just sheltered, and they would look after their immediate family. You could have fired a cannon in the early stages of the pandemic down Pick a Street in Ottawa, and there was nobody. Nobody was checking on each other. They were just concerned about what was happening inside of their four walls, maybe calling a parent or the odd friend. Shortly after that, we were getting calls where, so-and-so has just come back and they're out in their front yard and they should be isolating. So then it turned into this sort of tell on your neighbors type of thing. But of course they'd hide behind the window and, dial secretly. But we were getting those calls and having to respond to them. After, towards, sort of the end of the pandemic, when things started to lift, then we started to see neighbors would sit out in the front lawn, properly distanced. In fact, I did that a number of times just to see another face other than my wife and my kid. Not that that's terrible, but just to see somebody else, and we maintain that distance and have a conversation. Well, I mean, we've all been in meetings where after the pandemic, somebody would sneeze and they'd have to jump up. It's not COVID. It's not COVID, right? That's what we were experiencing. So in the beginning, not so much. It was like the zombie apocalypse. They were all hiding. Towards the end, things started to change, and that's where we started to see some of the neighbors and the community resiliency coming back.
Thank you. Jamie, we'll go to you. Just if I can spread the wealth a bit. Yeah.
Yes, good morning. Everything you've said makes eminent sense. But in the community, the message is not out there. I live in Greeley, Manotick Greeley, 100 homes, single family. You drive up the street, you drive into your garage, you put down the door. I know there's elderly, single, widowed women living on my street 4 doors down. I've never met them. I would hesitate going to the door, knocking on the door, because we live in a culture where we train the elderly to be suspicious. There's scams going on with people trying to sell you things. Don't give information out the door to people you don't know. How do you get this message across to a community such that there's an entry point for me to walk down the street 3 doors from where I live and knock on the door without scaring someone?
So I don't know if you've noticed, but I'm a little bit bigger than a bread box. To the folks in the room that actually remember what a bread box is. The way I did it originally was I went in one winter after a big snowfall, and I knocked on the door and I said, "You've got a lot of snow. Can I get rid of that? I've got a snowblower." And then the next snowfall, I did the same thing. And in the summer, I wandered over and I said, "Your grass is kind of going a little wild there. Can I help you out?" And then I became the really nice guy down the street that would come over and help with the lawn, help with the driveway. "Hey, I saw your number there's a little crooked. Can I help you with that?" "Yeah, absolutely." And then walking down the street, "Oh, hi, Sam. Oh, hi, Mrs. Roberts," right? And we would have a little conversation. You've got to start small if you can't just go knock on the door. "Hi, I'm a really nice guy down the street," because then they'll really think you're a little creepy. And then we get a different set of calls, right? But that's where you sort of have to start. So when I said, "Do you know your neighbors?" and you're having a chat over the fence, having a drink, cup of tea or whatever, and ask. There's an elderly lady down the road. I saw her going in. Well, looked like having a hard time. "Oh yeah, I know her. That's Gertrude, and she does blah." Right, and that discussion starts to build community. because now you know that lady down the street. So when things go bad, ice storm, darkness, then you can knock on the door and take a step back from the door. Always take a step back if you're doing it the first time. Otherwise, we get that 911 call. And hi, I'm down the street. I'm just checking to see how you're doing. That's it, right? They may say, I'm fine, don't come back. Great, but you've done your thing. And they'll know that people are looking out for them and start to build that community resiliency.
Okay, we have time for one more question. Gabrielle?
I will be brief, and I apologize, but sort of two parts. So the first question, Sam, you talked a little bit about the need for various emergency services providers to collaborate, to sit down, to break down barriers, especially given sort of the seemingly increasing number of emergency situations that we're grappling with. I think obviously people sitting face to face is going to be the best outcome, but I wonder, as these situations are becoming more and more frequent, if in your view you think it would be helpful or a hindrance to have more sort of jurisdictional guidance about how all of these various services and agencies are to collaborate. I'm thinking, for example, of the convoy. There was a lot of question about kind of who was responsible for what. Is it more prescriptive or less?
It's more. It's really tough. If we go back to the 2014 shooting, Parliament Hill, inside had its own security service, outside had the RCMP, outside of that had the City of Ottawa. And we also had the military, we also had the OPP, and we all have separate jurisdictions. So although Parliament Hill sits in the City of Ottawa, we as the Ottawa Police are bound to respond to that. But then all sorts of jurisdictional issues after that became a bit of a nightmare. That's a whole other presentation. But if we have our barriers, we have our borders of things that we can do, we need to sort of blend them and have that discussion. Well, I need this, but again, we don't need to have 40 emails and phone calls and so on. We need to find a way to blend that faster so that we know if this happens, I can pick up the phone and call this person and they'll get the machine rolling very quickly. If we have solid lines, then we're going to have that problem. And we saw it during the convoy. Federal government said this, provincial government said this, Ottawa Police. And when we brought in policing agencies from across the country, that's great. But you know what? The officers from Vancouver don't have jurisdiction to be police officers in Ontario. How do you deal with that? So we need to find a way to blend that sort of thing and make it happen quickly. Otherwise, they're sitting in a hotel on our dime, right? And we need them boots on the ground.
That's very helpful.
And I also think that the elective officials that we have, the councillors, they cover the whole city of Ottawa, and they meet regularly. So I think there should be at one point a plan from those councillors to get together. They get together every month or how often, I don't know now, but they do meet and they are representing their neighbors and their neighborhood. I know Mr. Rowling is probably my councillor, so he's not here now, but definitely they could organize a plan of preparedness with and the police commission and the police officers are under their jurisdiction. This addiction, sorry, my French there is coming out, no coffee, but therefore that is important that they could organize just a full day like this among each others and how they will deal with their communities, which is different. We have councillors that are looking more at rural areas more than urban. So therefore, I think they have the best opportunity to work in partnerships with the people that they have under them.
The word integrated and interoperability comes to mind. And as we speak to this, being a former armed service person, we talk about this when you're talking about working with other armed services, for instance, or other countries and having to work together. Simple things like you using different frequencies, different communication system. How do you harmonize this in times of emergency? Two examples that we often see that are not military or police related. Hydro goes down in a severe way and you have to invite or other hydro jurisdictions want to help and bring their crews, their trucks to help in your location. We saw this with forest fires this summer where other countries were sending forest fire personnel to assist. So additional resources are coming into your county, your region, your province to assist. And how do you bring all these people together who may not have jurisdiction to work in your location, but you still need those resources and you want to make it work. And so being able to practice these types of scenarios periodically is very helpful. Well, I think this is all the time. I've got to do my wrap up. So, and I know people want to be able to get on with the rest of their day. So, first of all, I want to thank Dr. Khan, Sam Roberts, and Nicole Robert. We really appreciate your time today and for sharing your insight, your knowledge. Today's session, I know, gave me a lot to think, and I'm sure it gave all of us a lot to think about. What really resonated with me is really empower people as far down the food chain as you can by giving them the wherewithal, the knowledge, the information, the resources in order to build resiliency at the lowest level possible, so that it frees up the emergency responsive people to deal with the actual crisis itself. So those are great takeaways. The leadership, governance, communication, something that we talk about in every situation. We need to practice this. Practice makes perfect, but you've got to take it seriously. So some of the messages that I'm taking away here this morning. I certainly hope that this conversation will spark continued dialogue on this topic. I know several of you are in the field of public health or in the field of emergency preparedness. I really thank you for being here today. And I'm sure with the network that you have, this conversation will continue. So this concludes our health and wellness series event today. I would like to thank you, our audience, both online and in person here at 700 Sussex, for starting your day with us with a breakfast. And I look forward to our next conversation together. Thank you. Miigwech. Merci. Have a great day.